Well, joining me via Skype is the Executive Director, Hazy Health Initiative, Rhoda Robinson. Good morning. Happy International Workers' Day.
Happy International Workers' Day to you too.
All right, to us about this report, the concerns you have with regards to this report that the UN is saying that because of the lack of access or movement, rather, women, there is the possibility of a population explosion, if I may put it that way.
Yes, thank you. As we all know, before the COVID-19 crisis started, there have been numerous discussions about Nigeria's population boom and our ability to actually cater for this population. With the current crisis, it's all the more important and paramount to keep focus on that because a lot of women have not had access to contraceptive, to information, or the choice to make, or the right to make those choices, are further put at a disadvantage as a risk now that we have the lockdowns and the restrictions in movement and the restrictions in resources as well. For instance, in the health sector, a lot of focus is being put on the COVID response, and rightly so. However, this is distracting resources that otherwise would have been into addressing health challenges of women when we talk about maternal health care, sexual and reproductive health, and access to family planning. And this would have a negative effect after the COVID period is over. What happens to the millions of women who have had to live through this period without access to contraceptive? You find that a lot of women would be put at a disadvantage and would be exposed to incidents of unintended pregnancies and would not be able to plan their families properly at this point.
Talk to us about the implication of this lack of access, if I may put it so. Could there have been other ways that the government could have strategically planned for this section of persons in the society?
Sorry, I missed that.
All right, I said you should talk to us about the implication of this on the society and if the government could have perhaps strategically planned towards made plans rather for this cross-section of people in the society.
I think with our current situation, it's kind of hard to actually say definitely what can happen. What we can do right now is make informed guesses at what we should be doing. We've already missed the mark on planning adequately for healthcare for women and those most at risk, especially young girls from underserved communities who already did not have access to basic social amenities and services. So right now, we need to start planning how do we effectively respond to this? How do we channel resources to ensure that they have enough economic opportunities to actually take care of their families after the COVID period? How do we improve maternal health care, especially for young and adolescent people who could have need for these services after this period is over? How do we start planning effectively for living after COVID? Because right now everybody is focused on COVID and nobody is thinking about after what happens after. Our economy is already in crisis. We have the risk of recession already, and those people already live below the poverty line. Statistics already say that women are 25% more likely to live in poverty, and this is going to be exacerbated during this period as well. So how do they get access to the already low access to contraceptives for women at this point? So this is what we should now start focusing on. How do we address the challenges that would come up because of COVID-19?
All right, we see that despite the challenge of COVID-19, people are turning to technology for alternatives to addressing whether it be education or jobs, whichever way. But couldn't that also have been used to address the situation and get the right information to those that need it?
Yes, this is one of the things that Hazy is currently working on. We are currently implementing technologies that, one, would provide people who really need it access to information they need to stay safe during this period and plan for the period after. We are also working on how to increase access to testing and risk assessment and knowing exactly what your risks are during this period. I think we have an opportunity to actually look further into what technology can do for us. And I'm not just referring to technology of smartphones, I'm talking about basic technology that the common man would be able to afford and access at the same time. So these are the things that we need to start focusing on. If we had planned properly and if we had invested more in our technology and our education system, a lot of the challenges we have right now would not hit us this hard. Because yes, COVID-19 is hitting a lot of countries terribly, but the extent to which you can actually respond to it on your resilience to the crisis is very important to know how you're going to fare going forward. And I think more investment in technology and research is needed at this time, especially when it serves as one of the major tools to keep communication between different individuals and different communities at this point.
All right, Rhoda Robinson, thank you for speaking with us on TVC Breakfast. Joining me via Skype is the Executive Director, Hazy Health Initiative, Rhoda Robinson. Good morning, and thank you for joining us on TVC Breakfast.
Good morning.
Now, some would say that why should we as a government, people, focus our attention on population explosion at this time when there is a bigger elephant in the room that is somewhat reducing the population, especially with regards to the number of deaths that we have witnessed across the world?
Okay. Thank you. I think one of the things that we should factor in when we're talking about population is that it has to do with immigration, birth rates, and death rates. Yes, COVID-19 has dealt a big blow to the global society at large, leading to millions of people dying. And it has also led that blow to our economy as well, and our ability to actually cater for our population. Nigeria had been working on managing our population and managing our resources to be able to take advantage of the population boom that would result, or that has been expected going forward. However, with the recent crisis, it's becoming bleaker when you think about the prospects of Nigeria as a country being able to manage this population. According to the UN report that you had earlier mentioned, we are expecting to see an increase in unintended pregnancy. And this is because a lot of resources that had been directed towards the cases of and issues of sexual and reproductive health, including family planning and maternal health, have been diverted at this point. When we're talking about funding and human resource as well, you'll find that a lot of care has been taken away from addressing issues of maternal and reproductive health currently. And I think if we do not continue to keep our eye on this issue, we'll find that when we get to the recovery phase of the COVID-19 pandemic, we might not be able to handle the negative outcomes that would result from this lockdown and this pandemic.
All right, before we go to keeping our eyes on this issue now, unwanted pregnancies and the likes that you have mentioned, is this a reflection of the level of advocacy that has been done, the impact it has had on the people post or pre-COVID-19? Because one would expect that people would want to protect themselves if they really are educated as much with regards to what the benefits of family planning and every other aspect.
Yes, Nigeria currently has less than 30% prevalence rates of modern contraceptive use, and this was before COVID-19. So now looking at periods after COVID-19, you're either going to have scenarios where we've lost the progress that we've already had, or a lot of people who need the services will not be able to get it because there won't be enough resources available to actually provide for those needs. And this would lead us to start questioning how ready our health system is to actually address the incidences and negative outcomes that would result out of lack of family planning, access to family planning. Would we be able to conveniently and effectively cater to the maternal and neonatal health care services that would be required? Would we also lose the progress that we've had in reducing maternal and child deaths in our society? These are questions we need to be asking, because a lot of people you'll find that we don't put too much effort or concentration on this kind of issue because it's not directly linked to COVID-19. But you find that because of COVID-19, these issues are gearing up as well. You might find that lots of people would stop attending ante and postnatal care because of fear of being infected or exposing themselves and their babies to the virus. And this might lead to complications in childbirth going forward. So we should not focus only on the short-term impact, but we should be looking at how this would affect us in the long term. What structures, what policy have we put in place to ensure that when we pass this phase of COVID-19, when we get into the recovery phase, we are able to handle the situation of an impending or expected population boom of unintended pregnancies.
And I'd like for you to quickly touch on how this will affect us on the long term and what strategic measures government can begin to take, perhaps post-COVID-19.
One of the things that we should focus on right now is to ensure that we realize that sexual and reproductive health care, including access to family planning, is an essential service. And it is something that the government needs to continue focusing on. We cannot afford to drop the ball at this time and lose the progress that we've had. We've already seen that it is difficult to manage our population with the current resources we have available. So if we keep dropping our budgets, if we keep dropping our funding to the health sector to provide for all the services, we'll find out it becomes more difficult to actually reap the benefits of demographic dividend when it comes to being infused. So government should put in place policies to ensure that women and young people continuously have access to sexual and reproductive health care services.
All right, Rhoda Robinson, thank you for speaking with us.